I need you to tell my mom that she needs help.
Yeah, 100%. Yeah,
Like,
yeah,
I've tried, it's no luck. So I need
yeah,
you to come in and
yeah,
support too.
yeah,
And sometimes hearing that from a nurse makes it all the world of a difference. Other times hearing that from a professional that whether they know I'm a nurse or not, just hearing it from someone else to say, look, we're not going to take away your independence. We're not going to come in as babysitters and do everything for you and tell your neighborhood that you're getting care for the
yeah,
things that you
yeah,
need every day, right?
yeah,
It's
yeah.
maintaining that sense of independence that's so huge. Welcome to Caring Conversations, the podcast where we explore the world of caregiving, family support, and the power of compassionate connections. So welcome to our first episode.
Yeah, happy to be here, Melissa.
I am here with my co-host, Liz Lewington. Liz joins us from Vancouver Island. So thanks for joining today.
Yeah, thanks for having me, Melissa. I am happy to be here. I've been a nurse working with seniors for 18 years now. I love what I do, and I love every day working with seniors in their own home to keep them happy, healthy, and safe. I know that that's your passion as well.
Yes.
Today, we're excited to dive into a very important topic and understanding in home care, breaking myths and misconceptions. There's a lot out there for sure. We'll be talking with Melissa, an experienced care manager from Ohana Care, who will help us break down some of the most common myths surrounding in-home care. Many people believe that in-home care is only for the elderly or for those nearing the end of life, but Melissa's here to explain how in-home care can serve a wide range of people, from those recovering from surgery to individuals with disabilities or chronic illnesses. In this episode, we'll address what in-home care really looks like, who can benefit from it, and how it differs from options like assisted living or nursing homes. Also tackle concerns about cost, quality, and emotional aspects of starting the conversation about care within a family. Let's get started with Melissa on Caring Conversations. So what
Thanks,
is
Liz.
in-home care?
So in-home care is really just what it says it is. It's care in your home. And your home can be any number of things, from your actual home where you've resided for several years. It could be home in a senior's residence. Could be home in a hospital, which we hate to call home, but we do offer services there as well. So yeah, I mean, it's different from care that you may receive like in assisted living, nursing home, or hospice care, because we do, offer homes care that covers the entire spectrum of the home. Light housekeeping, meal prep, all of the home care would be full encompassing of each of those things. Transportation, things like that, where you're not limited to care just in a home.
Yeah, yeah. I like to think of it as all those little things that go along with staying in your home. And the folks that we support are the people that need help with those little things. And it may not be something massive that's changed in their life. It could just be that they can't get the garbage can out to the side of the road, and that's going to be a barrier for them. So I love that. I love in-home care, and that's why I think we're both in this business. So who benefits from in-home care?
Yeah, so we actually can offer home care to anybody. It can be the elderly, it can be the terminally ill. It also can be, just like you said, people with disabilities, chronic illnesses, post-surgical support. So after an operation that you've had, or really anyone that's just struggling to meet their activities of daily living, which may be showers, reminders for medications, going out and getting groceries to make sure that you're eating nutritious meals, supporting with keeping your house safe. That may be cleaning up the kitchen, getting rid of the garbage, maybe shoveling the walk, any number of things to keep you safe and comfortable at home.
Yeah, yeah. So, I mean, that's a lot of services that are being offered through home care. What is the typical person that comes in needing support? What are they asking about? Do you know what the usual questions are that you get?
Yeah, I mean, lots of people will come to us and seeking home care. Usually they're not the people that are actually requiring the care. Very often it's family members that are concerned about their loved ones. who are maybe needing that next little bit of assistance and not ready to leave their homes to go to a senior residence or a long-term care, wanting to keep them out of hospital because of a recent, hospital admission due to fall or otherwise. So, yeah, I mean, I think the typical person is looking for additional support. And it typically is a family member. Sometimes it's,
Mhm.
the client themselves looking for support. But in all honesty, it does take someone a long time to get to the point where they acknowledge that maybe they're in need of some additional support. And usually it's a loved one that comes to us first saying, I don't think mom or dad are managing anymore and need
Yeah,
that next level of care.
I agree. Yeah. I mean, in my experience, run into people and they're at a place where if they had had that support 6 months prior, they wouldn't be in the state that they're in. So the lovely part that I really enjoy about the in-home care is being able to give that person back a little bit of themselves that they've lost due to changes in their capacity, changes in their mobility, and their overall health. And that's what that personalized nature of in-home care, where you make a care plan and it isn't just the tasks. It's not a task oriented
Mhm.
care plan. Yes, the tasks are in there because they will get done. We're professionals. It's what we do. But those little pieces where you say, what do you like in your coffee in the morning? Does your dog, what time does the dog go out for a pee? Those kinds of little things that you put into
Mhm.
the care plan that are not your typical task oriented care plan, and being able to offer that flexibility and timing and the ability to give people what they need when they need it instead of a one size fits all model, which is unfortunately the alternative.
Mhm.
Yeah, I love that personalized side of the home care that we provide.
Yeah, and I think a lot of it is proactive, right? Where, we're
Absolutely.
helping people with queuing versus doing. That's something I tell my team all the time. Let's cue our clients to stay as independent as possible, doing the activities they want to do. We have the luxury of time because we're not task oriented, so they can take 15 minutes to put their socks on and then feel the pride and the ownership of being able to have complete that task on their own. That's so important physically and just really spiritually, where they're able to feel, that pride of completion.
Absolutely. So, what are some of the biggest misconceptions that you've run into over the years about in home care?
Probably number one, that it's expensive and far more expensive than living in a senior's residence or a long term care.
Yeah.
I would say, actually, even with the government support these days, people are being encouraged to stay home. And
100%. Yeah.
yeah, and there's lots of resources out there that can support if funding is a barrier. Lots of home care companies that will support in making sure that that budget is not a barrier. So there's lots of options out there, but I would say probably money and it being an expensive service is number one misconception.
Yeah.
Another one that I would say is that you need to be sick to get home care. Like, you
Mhm.
don't need to be sick. You don't need to have an ailment really at all. It may be a disability that you've been living with all of your life. It may be you're 75 years old and just tired of washing the floor. So there's lots of things that, prevent you from being able to doing those things to maintain your household and to be looking after yourself and those personal
Yeah.
care items.
Yeah. I agree. So, are
What
there
about
any
you?
age? Oh, gosh. Um, Ditto. Have you ever run into any age groups or demographics that you feel would benefit from in home care that don't really consider it an option?
Well, I mean, pediatrics, I think families in general.
100% agree.
Yeah.
Yeah.
I don't think we look to a home care company for support when we are a struggling family. Maybe we have a child with a disability, or we have a couple of kids and we have a newborn. We've had some clients that need sleep. As a mom, I can
Absolutely.
totally
Yeah.
relate to that. And having someone around that can support with the daily activities while I just get a break. I think respite is so, so important for
Absolutely.
everyone. I mean, if you're caring for someone, whether that be a kid, a senior, someone in palliative care, you need to look after yourself first before you can be a caregiver. Burnout is a
100%.
real thing.
Yeah. Yeah. That self care, being able to I mean, there is part of a grieving process that goes along with accepting that you need care as well. Sometimes people embrace it with open arms, but other times, you're brought into it sort of kicking and screaming because this is a necessity for you to stay in home. And if you haven't considered what it looks like when you come to somebody like us at Ohana Care, you're going to be pleasantly surprised at how it looks, what it feels like, and that support that you get over time, how you can rely on the person. You have a relationship with them. They know what you eat. They know, what time you go to
Mhm.
bed. They know what you like to wear on a Wednesday. Things
Your
fall in
favorite
place.
lipstick.
Exactly. Yeah. Yeah. And whether you want to wear it today or not, because you know what you're
Yeah.
eating, you don't want to get it on your cup. Yeah. So, I mean, those sorts of little things that we don't really consider part of the home care sort of journey, when they come to us, the outcome is always this really positive feeling. I think that's why we're both suckers for the business, because this is it's yes, it's a business, but really at the end of the day, I get to go to sleep happy knowing that I've been able to provide that good quality care.
And fulfilling people's wishes. I mean, I don't think anyone thinks about aging and is like, I am super excited to go to long-term care and I can't
Yeah.
wait to get
Yeah.
that old, right?
Yeah.
I think there's a grieving in that and the fear of the loss of independence and that, I'll be an invalid, at that time. So if we can fulfill people's wishes in staying home safe and comfortable, that gives me a huge sense of pride in what we
Yeah.
offer.
Yeah. Yeah. And pride really is a lot to do with it. Like you said, putting on your socks in the morning may very well be, a sense of pride for somebody,
Yeah. An
and you may not,
accomplishment.
and it's not something that you're overtly going to say, wasn't that great that you put your socks on? Nobody feels that way. But really, at the end of the day, if you've put your socks on for the first time in 6 months, this is a positive move, right? So, little wins, focusing on that is really important as well.
Yeah.
So when should they consider going to a facility instead
Mm.
of staying at home? Like, is there a catalyst for that you found?
Yeah, so I think it's totally dependent on what the family wants, what the family can afford. There is a financial aspect to it, of course, and the family's wishes and what they can commit to the care. There is no question that people can stay at home till end of life and through their end of life journey. We can absolutely support that with the luxury of having companions, healthcare aides, and nurses, and the support of the healthcare regions as well. So there is no reason why people can't age in place and that place be their home. But
Absolutely.
I do think there are situations where we have financial constraints or risk to a client to stay home. And those are
Yeah.
conversations that I'll openly have with families. We have had clients that were active elopement risks where, the decision was made that it's no longer safe for mom to stay at home.
Yeah.
I think that's a really tough decision, but very much a collaborative decision and lots of conversations around that.
Yeah. Absolutely. Absolutely. I find, with the dementia diagnosis, it's always really difficult for the family to feel like there's stability in that decision. So I
Yeah.
always like to counsel people to look into long-term care. So if there is an incident that happens that it stands in the way of allowing them to stay in their home, something safety related that we couldn't mitigate, then yes, of course, do your research. Research is always important in this stage of everyone's life. There's not a lot
Mhm.
of education around it unless you've been in the field. You don't know what you're facing, and there's a lot of fear around that as well. So education, learning about what resources exist and what facilities are in your area so you can stay closer to your home, your family, your community. But yeah, setting up that safety net so that you don't have to come to that decision lightly. You have to really invest in creating that safety net in your community, reaching out to
Yeah, and
neighbors and
knowing
family, and yeah,
yeah, and knowing that you have put in time and effort into making an educated decision versus a crisis decision. And no one wants
exactly.
to make those sorts of decisions in a crisis. Very often families will have second thoughts when they've made a decision in a crisis and be like, this
Yeah,
was absolutely not the right decision.
yeah, yeah,
We can support through that. And I strongly suggest, pool your resources, get multiple opinions, talk to people in long term care, in supportive living, home care, and just see what is available. It's an education for sure.
Absolutely. Because you find your families are in the hospital with their loved one. There's often it's a fall or something along those lines that's changed everything overnight immediately. And they're being pushed to a facility, because the hospital needs the bed, the space, and that's always the push and pull, right? Get out of acute care, get into long-term care. So when they're being faced with that, they need to know that they have the ability to say no. That there's
Hmm.
other options out there. You don't just have to accept moving into a long-term care bed because that's what's the easiest choice for that health authority or for the nurses or the doctors that are working that day. I know it's easy to say, but really it's a holistic approach. You can't just look at somebody and say you need to go to a long-term care facility. You need to go to their home, see what they're living like. What have they lost weight? Are they drinking enough? Is this something that's preventable that's brought them in? And can we fix it and return them to the home where they sleep better, they eat better, they have their community? Pets are able to stay with them because I know I love my dog and my cat, and having to get rid of them. A lot of folks have to get rid of their pet or give it to a family member or whatever it is like that. That's heartbreaking to have to face that at such a bleak time in your life when you're in the hospital with not a lot of
Hmm.
options, not knowing
And
that we
dealing with
exist.
so many losses, right? Dealing with
Absolutely.
that loss of independence, and then you add dealing with the loss of an animal on top of that.
Yeah. Yeah. And the home that you potentially raised your family in and your,
Yes.
yeah, and your community. Yeah.
Yeah, for sure.
It's an awful
And I think
situation.
to the point of what you say with being in hospital and providing an education, sometimes it's a matter of providing an education to the nurses and the transition team that are there as well. Very often,
Absolutely.
they're busy and very focused on one stream of care. And so being prepared to advocate for mom or dad's wishes as far as where they'd like to live, and, providing that team with an education like, look, I've spoken to this home care provider and this is what they can manage. Can we make this work?
Yeah, absolutely. Absolutely. I think there's a lot that needs to be done as far as educating everybody, like, and you can think that a doctor or a liaison at the hospital, a discharge planner, you'd think that they knew all that's going on because we have this sense that, a doctor knows all, but
Yeah.
really the niche that we are supporting is not a well-known niche because it's not connected to a health authority. But
Hmm.
sending somebody home with care from us, we can support them all, like you say, all the way through their journey until the end of life. Yeah. And that's the most beautiful part. I love that part, being able to
Agree.
move forward with the person, bring in occupational therapy so that we can support any mobility changes, lifts, transfer belts, wheelchairs. It doesn't have to be just done with somebody in a facility or in a hospital. We can do that as well.
Yeah. And I think back to the misconceptions too, is if you choose home care, you no longer get funded support. And in fact, that's not true. All of the resources that are available to anybody in their home, whether they choose private home care support or not, those resources are still available. So AADL to support with continence care, support for getting a lift installed in your home. All of those financial resources are still available, even if you choose to
Absolutely.
stay in your home.
Yeah. And the health authority prefers somebody else to take over the
Oh, sure.
care. So they're happy
Yeah.
to support us in remaining in place for them as well.
Yeah, for sure.
So how do you and our team create personalized care plans for your clients? What are the
Um, yeah, so I think it all starts with those initial conversations, like what brings you to home care? What prompted the phone call to us, and what are you dealing with? And then I think with experience, you start learning the nuances of, what people's goals are, how their interactions are with their families. Sometimes we get families that are like, I'm exhausted. I need to step away. Here's the problem, and we build a care plan around that where we need to give the rest of the family a break. Others times it's, someone who just wants that additional support to keep mom safe and comfortable at
Mhm.
home. And then we pick up on those little nuances like favorite lipstick. Mom must be wearing her lipstick every day, or mom never wants to be seen wearing pajamas. She always wants to be fully dressed, or dad must have his coffee one way or the other. So there's so much that we can learn through conversation, spending time with people in their homes, understanding how their home is set up, whether that home, again, be their home that they lived in for the last 65 years or their seniors' residence. Maybe it's participating in activities that previously they didn't want to participate in because they have mobility issues or some cognitive deficits. Now, if we send a companion in, they're able to attend those activities that previously they enjoyed.
Mm-hmm, mm-hmm. Oh, good answer. Well done. I going back to creating that care plan, putting in all those little things, but also I like to add in, if there's been urinary tract infections in the past, what does it present
Mhm.
as? And how can we cut that off beforehand? And increasing fluid intake. So taking not just those little personal nuances that everybody has, and creating the care plan with that, but also adding in as a nurse, you add in your what does it look like when this is happening? We need to keep an eye on this area on your leg because it's broken down before. What does it look like right now? So that our staff can go in and monitor it. And if there's any concerns, they alert us, we follow up, and then we can get a doctor involved before it turns into an acute care situation. So keeping
Totally.
us or a home care provider in place can really cut down on hospitalizations and poor
Mm,
outcomes because we can jump in and we can assess and we can get the medical attention that's needed when it's needed instead of waiting until it's an acute care situation, which is also
yeah.
a lovely part of the job. Yeah.
I totally forget about the clinical aspects of things. Not that I forget about them in a care plan, but I don't often talk about the clinical aspect of things because families want to just talk about what's going to make mom happy. But for sure, I mean, the benefit of having a nurse involved and a nursing team involved is for sure being proactive and being able to be preventative, in some of those things, avoid those hospital visits for sure.
Yeah.
And yeah, I mean, I guess that gets back into the task piece of things, but sometimes our documentation involves pictures of wounds and things like that so that we can monitor progression.
Mhm.
So very similar to the services that you would get in a facility or in a hospital as far as monitoring those things go. So yeah, for sure. I often
Absolutely.
just
Yeah. Yeah. So
bypass
that's sort
those.
of that's sort of our role as a care manager. What do you do? Well, once we've set up, we've got the care plan in place. What is the role that you kind of jump into as a care manager once every like the ball's rolling?
For sure. So any change in status, I'm actively involved. I love to be able to be on call and support our team in the field. From a manager's perspective, a leader's perspective, I always like to stay in touch with the team in the field, make sure that they're safe and that they have the support that they need.
Mhm.
And I think families, providing that reassurance that there is a nursing team in the background monitoring what is happening. Much of my job involves like sitting back and watching it all unfold, pivoting as needed, making changes based on feedback that we've received and conversations, right? We strongly believe in finding a caregiver that's a good fit, right? I never
Absolutely.
want to put someone in a position where either the client doesn't like them and there's not a good energy between them, or the caregiver hates going to work every day. That's not a situation that we want to be in. So definitely a lot of the job is adapting to that, making changes to that. So it's not just learning our clients, we learn a lot about our caregivers too, and the services and the care that they can provide.
Yeah. Yeah. I mean, they are the people on the front line. They're the ones that give us our good name from the compassion that they bring to their work every day. So they're invaluable human beings. I mean,
100%.
society couldn't function without our care staff. Absolutely.
Yeah.
Um, so when you're building trust with a family, how does that look for you? What's the
Mm.
relationship? How does it look when you're building that trust with them?
Yeah, I think sometimes it's innate. People are calling us and they just say, here's my dad, deal with it. And, that's totally fine. Other times it really is a process. You have to build that
Mm,
relationship with them. I have clients that I've been working with for months, developing that relationship, building that trust with them. Maybe it's trust with the family members, maybe it's trust with the client, and building those resources and creating that package that they're like, yeah, I mean, this is going to benefit my life versus become a hindrance to my life.
Yeah,
And
absolutely.
so sometimes it really is very dependent on where the client or the family is at in that stage and how much care is involved too. Sometimes if we have a palliative client, and there's a ton of care involved and the family wants to stay very, very involved, it takes a little bit longer for them to gain that trust in us and understand that, they can go to sleep at night and know that we are there to
Yeah,
care for
that
their
we're
loved one.
here. Yeah, we're here. Your loved one is comfortable.
Yeah.
Yeah, and I mean, like you say, trust looks so different for everybody. It
Mhm.
can just be a matter of please help, dear God,
Yeah.
please help.
Yeah. Here, take
um,
this.
yeah, yeah, and you're like, okay, that's great, thank you. What am I going to do here? And then your nursing kicks in, and the compassion that comes with the position, of course, kicks in. But yeah, the communication between you and then education, like that is such a big part of building that trust.
Yes.
Because you can go in and if your client is not ready, it doesn't mean that they won't be ready eventually, or that you're not going to be able to go out and give the information that the family needs to take a different approach, or you know what, this isn't going to work for your loved one. Have you considered these resources that also exist? It doesn't mean necessarily you're signing with us. Don't worry, we'll take over, and your hands are, sort of wiped clean of this. It is an education, especially around like dementia, Alzheimer's, teaching people that this is not, this isn't the behavior that your loved one has had their whole life. You know that.
Yeah.
And that this is presenting because of the dementia. This is not under their control. And just that education component, really, I feel like that is a big place where I build trust with my clients as
Yeah.
well. Just keeping communication open and listening to their feedback, and then giving feedback as to how things have gone. How did the visit go today? Did they eat anything? And just like that sort of trust that builds over time, that they then they're so grateful for it as well. Really, so
Yeah.
grateful.
Yeah, for sure. And I think some clients come to us with, I need you to tell my mom that she needs
Oh
help.
yeah, 100%. Yeah,
Like,
yeah,
I've tried, it's no luck. So I need
yeah,
you to come in and
yeah,
support too.
yeah,
And sometimes hearing that from a nurse makes it all the world of a difference. Other times hearing that from a professional that, whether they know I'm a nurse or not, just hearing it from someone else to say, look, we're not going to take away your independence. We're not going to come in as babysitters and do everything for you and tell your neighborhood that you're getting care for the
yeah,
things that you
yeah,
need every day, right? It's maintaining that sense of independence that's so huge.
yeah. 100%. Yeah, that's a good answer. You've done this for a while, hey? So
Maybe
what
a
other
little bit.
services what other services do you coordinate with? Are there other areas of nursing or areas of healthcare that you're coordinating with to make the best care in for the client?
Yeah, for sure. I mean, it's a multidisciplinary team, and I love to pool resources and take support from any number of people that want to be involved, whether that's a physiotherapist, an occupational therapist, speech language pathology, physicians we liaise with very often, funded home care. If they're coming in and
Mhm.
providing support 3 times a day for medication assistance or otherwise, we'll happily liaise with them, take on some dressing changes, things like that. So I would say that it's an endless realm of possibilities as far as who we can collaborate with. Pharmacists, you name it. Family members, my goodness, family members can span across the globe too, right? Where we utilize
Absolutely.
technology to keep people involved in care for mom or dad.
Yeah.
So I think
Yeah.
that's a big part too.
Yeah. 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 Absolutely. And everybody's different. Like we say,
Mm,
everyone's different and their journey is going to be different. So those resources that you're out there scouting, it's kind of like you're a detective all the time. Like what
yeah.
exists? Does this hairdresser go to the home? Is there somebody that will do the foot care? Is there an RMT? This person has a what looks like a pinched
Hmm.
nerve, or they're stressed or whatever it is. And bringing those little things in that can make the big difference. And OT, of course, keeping our
Yeah.
staff safe, keeping our clients, being able to ambulate. I love getting in the OT, and then physio. They prescribe the exercises. We assist with them so we can increase ROM and like range of movement and just their overall health, have people being able. I love it when you can work with somebody through their physio and you come back in 2 weeks later or a week later and they can get up out of their chair again.
Yes. Oh,
Who
huge.
knew? I mean, as a
Yeah.
mom, I hate getting up. I hate it so much. I want to sit. But you know what? When you're a senior and this is your Mount Everest, that moment of being able to get up out of a chair, I don't want to say that I've been brought to tears with that sort of thing, but it's
Mhm.
definitely been a moment in the vehicle when you get back in and you center yourself and you say, you know what, this is why I do what I do. I love it so much. And seeing those wins, just they hit home. It
Yeah.
really is
And
a
sometimes they're
lovely thing.
small wins, right? Like finding
100%. Yeah.
a set of shoes that fit someone with a
Oh my
size
God.
13
Yes.
feet and
Yeah.
has,
Yeah.
peripheral edema, like swollen feet, and
Yeah.
has not been able to wear shoes for so long. And it's a matter of like going to Red Cross and looking for the pair of shoes that work. And finally, you see a client wearing shoes instead of slippery socks in the house. Huge
Yeah.
win.
Oh,
Yeah.
yeah. Yeah. I know those moments. It's funny. Unless you're a nurse, I don't know if that kind of thing that you would take home and be like, hey, at the dinner
Yeah.
table, I found
This is
shoes for
so
somebody today.
exciting.
Yeah, you never believe it happened. Yeah, we're a sick group, but I think we have a intentions.
Oh, the things that excite us, right?
I know. We're an odd crew. Yeah. It's nice to have you in my in my wheelhouse here with
Yeah.
me.
Good company. Good company.
Yeah, yeah. Uh, so what do you think, what are the like future trends for home care? What are you hoping?
Mm.
Let's say imagine home care in the future. What are you imagining it to look like?
Yeah, for sure. I mean, I would love to see the integration of technology while still supporting that person to person care. I think we're going to see home care. We're going to see an increase of people staying in their homes related to capacity issues that we see in acute care or otherwise. And I think we're going to see a lot of support from the government as far as keeping people in their homes, debunking some of those myths as far as finances go, and starting to talk about what there is available to people to stay in their homes and to age safely and
Yeah.
comfortably in their home. And then technology too. I mean, I think being able to access cameras in the home and knowing that you're keeping your loved one safe and that they're not wandering the streets when it's, minus 10 and 2 feet of snow out there, knowing when mom or dad has taken a fall, and being able to respond immediately, those sorts of things I think too will be integrated into the home care industry and what that looks like in
Yeah.
the
And
future.
every time I go on the internet, you look up something, we need to make sure that if they're using the stove, there's a
Yeah.
trigger that it will turn off after an hour, or that if the smoke alarm goes, it'll cut the electricity to the stove. I mean, those things pop up all the time. So just that ability to stay connected to what AI is doing, what technology is doing, how
Yeah.
we can further support people by taking those little things away that are a safety concern,
Mhm.
and bringing in the human aspect. So it definitely is that marriage of technology and being there, physically being there. Yeah.
Yeah. And, it may be things that you and I don't even think about, like the Instacart for grocery deliveries or the robot vacuum. So many of those things
Yes.
we've integrated into our lives without issue
Yeah.
and don't even think
Absolutely.
at all. But how much independence those sorts of things would create for a senior in their home living alone.
Yeah.
So,
Exactly.
I think it's happening and we're even just oblivious to the fact that it is happening.
Yeah. Yeah. I do. I mean, I love finding new things to
Yeah.
help keep our seniors in their homes. I know there's a lot of technology push for, medication administration, those sorts of things. So I'm interested
Mhm.
to see what happens in the future. And I think that, government funding, absolutely, there needs to be a push for that. And it doesn't mean that there's going to be them and us as far as public and private. It is 100% going to have to be an integrated approach to keep our folks to age in place. I know they push that term so much, the aging in place, but really, what does it look
Yeah.
like? And
Yeah.
that conversation needs to be pushed up. So if anybody out there listening has any any clout anywhere,
Yeah. Any
please
pull.
push for home care because it is definitely a forgotten place acute care, long-term care. There's other options out there for folks.
Yeah, and I think it goes beyond seniors too, and how that technology is integrated in the home. With some of our pediatric clients, what AI is doing, text to speech, and how they're supporting kiddos in their homes, and how, cameras in the homes or air tags are keeping their kiddos safe. I mean, any number of
Absolutely.
things. I think, again, we overlook in our day-to-day lives, but those elements of technology can support anyone of any age group when you're dealing with disabilities or ailments of any sort.
Yeah. Yeah. So, I mean, home care, it's such a beautiful place to be able to call our
Well,
field of expertise, to call home. I was trying to avoid that, but yes, it is. It's a beautiful place to call home. This is a position that I have loved every moment of every day that I'm in. And as a nurse, it's really difficult to find that
mhm.
place in your life where you can say this is what drives me. Absolutely. So, um, it. I mean, do you have anything that you want to say before we wrap up?
No, I think I'm really excited about this podcast and to be able to provide that education and those resources to people. I mean, it's not about Ohana care. It's about, talking about home care and the options that are available, and how can you support people of all ages to be where they are most comfortable and to keep
Hmm.
them as safe as possible.
Yeah, it sneaks up on you. My God, when you take a phone call from somebody and you think they're talking about a loved one, a parent that's 72. My mom is 72. Oh
Yeah,
no.
yeah,
What am
for
and
sure.
I'm a professional. So for folks that aren't in it, it can be a really scary thing. So I think this education is really important to get the word out there. What does it look like? What's the approach? What options are there? 100% this is important work that
And
that
that
we're
it's
doing here.
not scary. Like,
Yeah.
we're here to keep people as independent as possible. We're
Yeah.
not
We're
here to
part of
take
the
that away.
community.
Yeah,
Yeah. We're
for
part
sure.
of your home, part of your community.
Yeah, it's
Yeah.
just us.
Just don't worry, just me. Yeah.
Yeah. We'll become a familiar face.
Yeah.
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 Well, thanks so
So
much, Liz. I mean, I think this was a
thank
great
you.
first conversation, and appreciate, digging deep into some of these issues and talking about some of these myths that surround home
Yeah.
care.
Yeah.
So thanks so much. And I am really excited to chat next week on our next
Yeah.
topic. But yeah, this is Melissa signing off from Calgary in the bitter
And
cold
this
and the
is
snow today.
oh yeah. So this is Liz. I'm over on Vancouver Island in BC. It is a lovely
Hmm.
overcast day today.
All right, guys, take care and we'll chat soon.
You got it. Thanks.
See ya.